Hey guys, Dr. Luke Stringer from Advanced Health Chiropractic, and a really common question we get asked all the time in the office, and unfortunately it's a frustration for many of patients that come in to see us: why does my pain keep coming back? So when you're discussing low back pain, we have to address three main areas: the structure of your spine, the function within the joint, and the health of the soft tissue. So essentially, unfortunately, when you go to see some providers, they're just going to address the pain aspect. Now, pain can be a great indicator to your health, because if you're in pain, something's wrong, it should be addressed. However, only 10% of your nervous system is sensory, so the 90% of your nervous system is asensory. It controls essentially function within the body. So when you're just treating pain, it doesn't necessarily mean that the problem is going to be gone forever. So what we tend to find in the office is, when we work with our corporate athletes, people who have to sit for a living, the spine, when you evaluate it, should have a nice even curve, should measure 40 degrees. And we have that so the weight of our body is displaced evenly into the back of all this bone here, hence why it's there. After all those years of sitting, those repetitive stresses, the front of us, our anterior, gets really dominant. So our muscles essentially get super tight in the front, weak in the back, and our spine shifts out of alignment. As we discussed on previous videos, the weight shifts from the back of the spine to the front. But if it shifts to the front and you don't address it, we start seeing issues within the disc. So when you evaluate a healthy disc, obviously you should be able to see that low vertebrae, upper vertebrae, and a really plump, big disc. It's got really strong collagen fibers and nice healthy disc fluid. Creates a nice big hole for the nerves to come out of it. It allows us to function pain-free. However, all those years of sitting, we start seeing the disc thinning within the spine. So when we get disc thinning, essentially phase 1 degeneration, like we see here, the disc starts to degenerate and we start to lose height. Not only do we start to lose height, but the disc starts to lip out outside of the vertebrae. It starts to shift into those nerve canals. Obviously, if you put stress and tension and pinch on the nerve, you're going to get pain in the low back. So when you address low back pain, it has to be started. So when you address low back pain, the structure of your spine has to be addressed. Because if we don't address the curvature, i.e. we don't get the curve back into your spine, then the weight's going to continue to crush the disc at the front. And obviously the more disc pressure, the more degeneration, the more pain the problem's going to have. We practice a specific technique called chiropractic biophysics, where we can objectively change the shape of your spine, and by doing that we can offer you long-term results. And the second thing we focus on in this office is the integrity and the health of the tissue. Soft tissue is designed to support and stabilize your spine, essentially through anything we do, specifically through motion. And when your spine's within normal limits, the tissue looks a little bit like this. So healthy soft tissue under a microscope should look really structured and uniformed. But when your spine shifts out of alignment, we have those repetitive stresses such as lots of sitting, the tissue essentially gets beaten up. We call this adhesion. It's technically collagen, it's scar tissue. It's like me sticking a bunch of chewing gum in all the muscles that support your lower back. So essentially, if you don't address the soft tissue, so those repetitive stresses break this tissue down, well, the body isn't going to allow you to function with poor health within the soft tissue, so it heals, right, and will self-regenerate. And when it self-regenerates, it does so with something called adhesion. It's collagen, it's scar tissue within the muscle. This essentially now becomes the support system and the pulley system that supports and moves your low back when you're sitting, standing, or moving. Well, this tissue is obviously weak and inflexible. Well, if we don't address this tissue through specific treatment, then the low back pain has a great chance of continuing to come back. And unfortunately, this tissue breaks down far quicker than this tissue. And that's just your low back pain getting worse every time it goes out, or essentially the longer we leave it. So if you're suffering with low back pain, you have a co-worker, a family member, a friend that is suffering with low back pain, you've seen providers, you've found relief, and the pain keeps coming back, we encourage you to hit the button below, fill out the contact information, we'll contact you, we'll get you set up for a detailed consultation, we'll go through an exam, some x-rays, we'll pinpoint your issue, and we'll go over a really comprehensive treatment plan so we can get you out of pain and get you functioning pain-free.